Hello, my name is Dr. Renae Reinardy, and I'm a licensed clinical psychologist in the United States. For the past 25 years, I've specialized in working with children, adolescents, and adults struggling with anxiety disorders. I'm excited to share this video series with you, and today we'll get started by talking about some mental health facts, and I'll also begin by sharing a few skills and some considerations to improve mental health and emotional wellness, maybe in yourself, your family members, and in our communities. So I'm going to share my screen with you and we will get started. Moving toward improved mental health. So the name of my practice is Lakeside Center for Behavioral Change. I also have a company called Courage Critters, and I was invited to speak with you all through You Save Foundation, and I'm very excited to do so. Let's begin by talking about some mental health facts. According to the World Health Organization, about 1 in 4 Nigerians experience mental illness. In the United States, that number is about 1 in 5, and worldwide, it's estimated that at least 1 in 8 people struggle with mental illness. When we do the math, that number comes out to be about 1 billion people right now on Earth struggling with mental illness. Nigeria does have a high rate of suicide. The research that I found, Nigeria is ranked number 15th in the world for suicide, and in Africa, it is one of the highest places for suicide completion. I believe that that can change by challenging stigma, challenging myth, and clearing up misunderstandings that people have about mental illness. That can be done through education, early detection. Actually, about 75% of mental illness begins in childhood and adolescence, so early detection is really important. Prevention and skills training. There is a need to improve access to care. As you're aware, there are over 20 million people living in Nigeria, and right now, only about 150 psychiatrists. During COVID, many medical providers left the country, leading to a shortage in a number of areas, and psychiatry was one of them as well. Fewer than 10% of people in Nigeria struggling with mental illness get the care that they need. So we have to come up with some creative solutions. And one might be to shift from a hospital-based program to more of a multidisciplinary, community-based approach. This can be done through a partnership between psychologists, psychiatrists, nurses, and other medical providers, and very importantly, community and religious elders. Through these creative solutions, we can move more toward the direction of social acceptance and understanding of mental illness, and that probably has to start at a grassroots level. So why do we want to focus on a community-based approach? When we do so, we improve access to care. We might also want to consider incorporating mental health screenings and some mental health tools into primary healthcare services. Early detection and treatment are really important because when we do so, we can actually prevent other struggles that result from untreated disease. Things like substance abuse, academic failure, social struggles, and suicide. When people are receiving community-based interventions, they can maintain family relationships, and we can also provide support to family members, loving and caring for those struggling with mental illness. People can maintain employment during their care. They can receive more consistent care, which also increases the likelihood that they're going to improve from their symptoms. When we take a more compassionate and anti-stigma approach, we can maybe utilize some campaigns that will improve access to care and also have people feel more comfortable accessing that care when they understand a little bit more about this particular area of health. Efforts are being made to do so, and certainly there's more work to do. I became aware of an organization called Mentally Aware Nigeria, which sounds like a great organization from what I could see online, of 1,500 youth volunteers going out into the community to help increase awareness about mental illness. Through access, health policy, and funding in this area, I believe things can really move in a much better direction. So that was a little bit just about some basic facts about mental health and mental illness in Nigeria. I want to shift gears a little bit and talk about some strategies that you may want to practice yourself. We'll actually practice a mindfulness strategy together in just a moment. And some other things that you want to think about when starting to improve mental well-being. Let's talk a little bit about mindfulness. Mindfulness is oftentimes misunderstood as relaxation. Practicing mindfulness can be relaxing, but mindfulness really is about increasing awareness, having a better understanding of what's going on in our own mind. When we do so, we can reduce our reactivity. And how that works is we're slowing down enough to become more aware of our thoughts, our feelings, and how we're responding to situations. Rather than just reacting, we're able to slow down enough and respond in a more effective way. There are many physical and mental health benefits to mindfulness practice, and it is a skill that does require practice. It's like anything. The more we do it, the more effective it becomes. So I'd like to start off by practicing one of my favorite mindfulness exercises called 5 senses imagery. And I provided an image here that you maybe practice with, but certainly feel free to use any image that comes to mind. Just think of a peaceful place, somewhere that you really enjoy being, that really brings you a sense of joy, safety, and comfort. Now we want to incorporate our 5 senses into that imagery. First, thinking about, what do we see? What are all the things that you see around you? So in this image, I see a waterfall, I see plants, I may see some people around who are with me. I may see some wildlife around me. I may see the sky, the sun. What do I hear? I hear the noise of a waterfall. I hear people laughing and having fun around me. I hear my own breath. I hear the bushes moving around a little bit in the wind. What do I smell? I smell the water. I smell my perfume that I'm wearing. I smell the plants. I smell the earth. What do I taste? If I'm not eating or drinking anything, I may just have this sensation of being satisfied. I'm not thirsty, I'm not hungry. And what do I feel? Do I feel the warmth of the sun on me? Maybe my feet are in the water. Maybe I feel a gentle breeze against my skin. I feel the pebbles underneath my feet. And we can take 3 to 5 minutes just really focusing on that image, focusing on those sensations, and maybe calming our breath and our mind as we do so. This is a great exercise just to practice being still, practicing being more aware of our own internal sensations, our thoughts, to calm our mind enough to learn how to respond rather than react. I like to begin with this exercise when I work with people because it really helps them to increase awareness of their internal experiences. When we become more aware of our internal experiences, we also need to learn how to label them. And I like this chart. It's called a feelings wheel or an emotions wheel. And actually, research has shown that we have about 32,000 combinations of emotions. So certainly this doesn't capture all of them, but some of the more common emotions that we may experience. When we learn to effectively identify our emotions, we learn how to manage them better with skills rather than just going forward in robot mode, not having awareness, not paying attention to ourselves. When we pause, we can pay attention to our internal experience. We can catch it sooner and attend to those things more effectively so that we don't continue to travel in unproductive ways. It's important to understand that we all have different levels of sensitivity, and that level of sensitivity can change throughout our lives too. So, through lived experiences that we have, biological changes, hormonal changes, we may experience emotions more or less intensely. Even just our temperament, how we entered the world. And certainly you may see that in your children and different temperaments that they may have. It's important to increase positive emotions. So we do want to understand we're going to experience all of these things. It's the full human experience. We're not happy all the time, and that's okay. It's important to be able to understand and pay attention to the times that we are feeling sad, for instance. And even the emotion of sad can be a lot of different things. Does that mean that I'm feeling lonely? Does it mean that I'm feeling vulnerable? Am I depressed? Am I feeling disappointed, right? So there's a lot of different things that we want to look at and see, where am I falling there and what exactly is going on and why? We can increase our positive emotions when we notice things that make us happy, that make us feel excited and accepted and proud. We can lean into those experiences more often. We can learn to build distress tolerance, understanding we're going to experience the whole wheel, all of these different things. And when we accept that, expect it, we can also learn how to build more tolerance to those emotions. We can learn skills to better surf those emotional waves. So that leads to a more balanced interpersonal life, the things that we experience in our own mind, and also our interpersonal life, our experiences that we have with other people, in developing more effective relationships in our lives. But we have to be able to increase awareness, increase understanding of what we're actually feeling. Another factor that I like to talk about, and honestly, each one of these slides could be a lecture in and of themselves, is emotional vulnerability factors. Once we're better aware of our emotions, we want to pay attention to the factors that contribute to our emotional experience. These are some of those factors. Sleep, exercise, and nutrition are very, very important and are oftentimes overlooked in mental health. For sleep, for instance, the average adult requires between 7 and 8 hours of sleep. The average child requires at minimum 10 hours of sleep a night to have a healthy mind and a healthy body. With nutrition, it's really important to understand this bidirectional relationship that we have with nutrition. Nutrition impacts our mental health, and our mental health influences the nutritional choices that we're making, for instance. So it's important to understand the role of nutrition and how that impacts people's well-being. So we want to make sure that we're well hydrated and that we're receiving the nutrients that we need to have a healthy mind. When factors are happening that don't allow for that, there oftentimes will be consequences to people's emotional health, their ability to concentrate, their ability to attend, and physical health, of course, too. Exercise is another important variable and something to look at with our overall well-being. This is an area that oftentimes is overlooked. And so it's important to understand the role that exercise can play in balancing out some of our brain chemicals and our hormones and things that we don't even completely understand yet. But in research, we see the benefits in mental health and, of course, physical health when people are engaged in a consistent exercise routine. There are lots of things that we can do to improve our sleep, nutrition, and exercise. One that I would really recommend is routine. And I mentioned that with exercise, but with sleep, to make sure that we're getting a consistent sleep schedule, a consistent bedtime, a consistent wake time, to sleep in a place that we feel comfortable, to have a designated space for sleep, to have adequate meals and to have them structured throughout our day. So to be eating and drinking regularly is important to mental health. Exercise and looking at when that's most likely to benefit us. We don't want to exercise right before bed because that can disrupt our sleep cycle, but it is important for our overall well-being. Substances and addiction. This is something that it becomes a vicious cycle for a lot of people struggling with stress or emotional factors too. That oftentimes when people are experiencing mental health crisis, they'll turn to substances to help regulate those feelings. And while sometimes that works for the short term, it creates more emotional vulnerability. That means that people's emotional fuse tends to go shorter when they use these substances, sometimes for months after using certain substances. So if someone is socially anxious and they drink alcohol to help calm their nerves in a social situation, again, that might help temporarily, but by drinking alcohol, it actually is making them more anxious in the long term. So we do want to look at the role of substances and addiction in people's overall mental health and well-being. There are other psychological factors in co-occurring mental health conditions that need to be considered. Again, looking at temperament, looking at just how people enter the world. Some people are just built a little bit more sensitive than others. That's okay. It's important to understand that when that's the case. People oftentimes struggle with more than one mental health condition. So people may experience both anxiety and depression, and that's important to understand. Or difficulties with attention and concentration, like attention deficit disorder, along with anxiety, for instance. It's important to understand the role of acute and chronic stressors and medical conditions on people's emotional health, and to be able to treat those factors as well. So with some of the things that we talked about today, I want you to think about what can you do to improve your own emotional health? Do you think you maybe can incorporate a little bit more mindfulness practice? Is there anything that you can do with your nutrition or with your sleep that might decrease your emotional vulnerability factors and give you a little longer fuse to respond rather than just react in a stressful situation? Is there anyone in your family that may benefit from using some of these skills or this information that we talked about today? Again, 1 in 4 people in Nigeria struggle with a mental health condition. So if you have more than 4 people in your family, it's likely that someone is struggling with mental health. What information can you share with your community to better serve them? So these are all things to think about. And any questions that you have along the way, please write them down. I'm happy to go over things with you as well. And I'll certainly do my best to find the answers or share additional resources. So with that, we will conclude this introductory video, and I will see you in the next video. Thank you for watching.